Hey guys, it's Dr. Beard again. Welcome to Self Care is a new healthcare podcast. This is episode number 2. I'm talking about how to navigate the current healthcare system with this functional medicine model. I know a lot of you have been frustrated with trying to find a doctor who is more open-minded, willing to work with functional medicine practitioners, and just have questions about how to use the system in a way that is beneficial for you and
Right.
it's not wasting your money and making things worse. And we're going to talk about that. But first,
The Hellroys.
the Hellroys.
I don't take nothing that a doctor don't prescribe. I don't do no drugs, man. I don't do no drugs, man. I don't smoke no bud, man. I don't do no drugs, man. It angers up that blood, man. So I don't do no.
All right. So, if you've never heard the extra part of that song, I highly encourage you to do so.
That's why we chose it.
That's why we chose it. It's pretty funny, but we couldn't put it in the front because it was kind of too long of an intro, so we had to put it at the back end.
But
It's pretty entertaining.
It lists most of the drugs that most people are on.
Yeah. Anyway, just do that. So before we get started, you know what I got to do. This content is for informational and educational purposes only. It is not intended to provide medical advice or to take the place of medical advice or treatment from a personal physician. And I am not your personal physician.
Right.
Okay.
Well, let's try to get through this one because this is one of our more boring episodes, but it's very necessary. So let's just kind of delve in. Amy, there are parts of the system that work well. I mean, obviously, our listeners know that you're not traditional medicine, but what works well? Because we don't want to throw the whole system
No,
away.
no. There's lots of good parts of that. From my experience, I think we do a great job in the ER. You know, if you are having a heart attack, stroke, some type of trauma, you've been in an accident, we can
Patch you up.
we can patch you up quickly and get you where you need to be as quickly as possible. So I think we're doing excellent there. I think the urgent care centers that have cropped up over the past few years serve a vital role within the system. I think they take a lot of the burden off of the ER so that we can spend our time managing, the issues of the emergent cases better, and we're not weighed down by all the stuff that really probably shouldn't be there.
The ICU works well.
The ICU is fantastic, those intensive care units. And then, our surgeons are great. I
Right.
mean, we've got some, the training for our surgeons, I think, is really, really good. And so, they're trained well. Sometimes, to a hammer, everything looks like a nail.
Right.
So the surgeons like to cut.
Cardiologists like to stent.
And for functional medicine doctors, we always like to look at the microbiome, so
Right.
we all have what our specialty is per se, and
So-
that's
so
what we
our-
like to focus on.
So our surgeons are great, but sometimes we're not using them correctly.
And
'cause-
even some of the specialties, some of the procedures and things they do, I think are, I'm glad that we have those. Interventional radiologists, glad we have those. I mean, they can do some amazing things when you've reached a point to where, it's no longer about prevention of disease or management of chronic issues, but you have acute issues that need to be dealt with right then.
And that's your main gripe, is there's a disconnect between the preventative that should occur.
There is no preventative
Right,
in medicine anymore, and I think we've gone over that, ad nauseum.
which we continue to do.
And we will continue to enforce that point. But when we fail, it's really the management of just the term management of chronic disease just irks me.
But do you think a
why are we managing it? We should be trying to get to the root causes, right? And quote, cure it.
Well, and who should be doing that? I mean, should the surgeon be talking to you about that?
Any doctor should.
Any doctor.
Any doctor can, and that's why functional medicine is so great, because it's not a specialty. It is an approach to uncovering and addressing the root causes of your current issues.
So a surgeon.
There's no reason why surgeons can't do this either.
So a surgeon could be a functional medicine doctor.
Yeah, they could certainly use a functional medicine approach. They just, most of them don't have time. The system's not set up for you to investigate really is what is at the root cause of your problems, okay? These people are busy. They're just not set up to do that.
All right. And our diagnostic services.
Yes.
So labs, X-ray, MRI, CAT scan, PET scan, best in the world.
Yes, I'm so thankful for those imaging studies.
You always say that wellness is non-existent, but we do have some prevention that works.
Well, yeah, there's some procedures that are really, I like the fact that we can do, cardiac caths and check your vessels out for signs of inflammatory processes going on inside your vessels.
That's a pretty invasive one. I mean, colonoscopy.
Colonoscopy is a great one too. There's risk with all of these procedures. Okay, you just in each case deems a look at your specific risks and benefits.
Is that why you're not a huge fan of X-ray mammography? Because of the radiation, the squeezing.
Yeah, and that's a whole other topic that we can discuss at some point. Is just mammography in general.
That's its own.
And yeah, that's a whole other discussion that we can have. So in colonoscopies, colonoscopy probably saved my life.
Right.
I had one at 32 because I was having a lot of GI issues. So we took a look up in there, and lo and behold, I had some high-grade neoplastic polyps that were taken care of. And had I waited until 50, which is what we recommend for those of you who don't have a strong family history of colon cancer, I probably might be dead. Colon cancer is where, colonoscopies is where it can really, that ounce of prevention is worth a pound of cure.
Right.
Because once colon cancer, once it invades that, spreads beyond the lumen of your colon and metastasizes, it's not good.
So we have things that work, things that don't work.
Labs, there's some labs that we can do that can kind of give us a little bit of a snapshot of what your kidneys are doing and things like that.
But in general, you believe that the allopathic model, the treating the symptom model.
It's just designed to treat symptoms.
But
with pills.
It's been
at least that's what it is now.
It's been exposed though. It's starting to be exposed.
Right. And I want to make sure that we stay on topic here, and this doesn't turn into a complete bashing of the system again. But yeah, I think it's going to change because the house of cards, I think, is starting to fall.
The house of cards
of just the pharmaceutical approach to health.
And
it's not working. We are spending so much money on health care, and our outcomes are horrible.
Well, that's what I wanted to establish. But
everybody wants to play the blame game. It's not medicine's fault. It's everybody's. It's they want to blame it on all kinds of other things.
Right.
But
I just want to establish that the allopathic model is broken.
But the buck's got to stop somewhere.
Right.
If you call yourself healthcare, I think probably the buck might stop with you.
Well, and that's the purpose of this. That we're trying to establish what you need to be doing, and then what parts of the system can still work.
Yeah.
And then where we want to take this in an ideal world.
Right. And what is that?
That's my
Instapot.
It's my Instapot going off.
See, we really do use that thing.
I'm actually fermenting my beans in order to get rid of the lectins and the phytic acid.
Oh yeah, which is a whole other topic we will be discussing.
All right. So, in order to navigate the allopathic model's broken, but is the one that we're living in now. So we have to. You can't be an idealist. You have to work within the system.
Right.
So why do we need? You always say you have to have a PCP.
Yeah, you need to have a PCP, preferably one that is open-minded to functional medicine approaches, which I have found to be far and few between. We tried to help our patients at one time by starting a list of physicians in the state that people thought would be more open-minded to working with us.
That evaporated.
Completely evaporated. Like, we were sending people, these were just recommendations made to us by, other followers, and people were going to these recommended open-minded physicians and being really, really disappointed. But we tried, and I think you're going to be best off with and they exist, but there's not that many of them, but functional medicine primary care docs. And they're usually in these direct primary care models.
So direct primary care, folks, they're in the insurance model in the sense that you can use your insurance for labs, but the time of the physician is paid by you by cash.
Yeah, and it's usually some type of monthly premium, or sometimes it's yearly.
But typically between the $100 and $300 range would encompass the vast majority of direct primary cares, which equates to $1,200 to $3,600 a year
And
for much better access.
much better access. There's a much lower patient load for the physician, so they're able to spend a lot of time with you. The access is tremendous. Now there's telemedicine, email, text messaging. A lot of these DPC clinics, the physicians will allow that. And most people who join them are very, very satisfied with the services. So I would strongly urge you to seek those out. There is a DPC, a functional medicine doc in Bentonville, Arkansas, Dr. Anna Erbst. I've met her. She's a lovely individual. I would highly recommend that you check her out. She's at Salt Health in Bentonville. I do think they require a once face-to-face meeting. And then she can handle a lot of your needs telemedicine. So if you don't live in Bentonville, you could still,
Try to use that.
try to use her via telemedicine and things like that. But of course, if acute issues come up, that's kind of where you can't drive to Bentonville. You could take advantage of an urgent care center or something like that in your area.
So the direct primary care where you pay for the physician and don't use insurance.
And we've done this model before.
Right. There's not that many out there.
Right.
And a lot of them are traditional medicine, but they're just taking fewer patients and they're not taking the insurance.
You're still getting access to the same old type of approach.
Right.
It's just that these doctors tend to be a little bit more prevention minded
Well, they have more time.
because they have more time. But if they're not functional medicine certified, or at least call themselves functional medicine, or at least admit to the fact that your microbiome plays a big part in your health, and I don't find that they're very valuable because they're still going to be prescribing pills for an ill.
Better access to crap.
Yes.
Okay.
Yeah, basically.
But you always say, in spite of that, we still need a primary care provider. Why is that?
Yes, because that's the gatekeeper to if you want to use your insurance for imaging studies and things like that might come up that you need, they're going to have to order those for your insurance to pay. So you still need a primary care doctor for that reason. Doesn't mean you have to see them all the time. A lot of our patients have primary care doctors, but they choose to work with us on their chronic health issues because they have found that their primary care doctor is just not getting the job done because they don't have the tools to uncover and address the root causes of their problem.
So later on, we're going to talk about different types of insurance that may be more cost effective. If someone wanted to establish with the PCP but did not want to use insurance, the PCP would allow that, right? They'll still allow.
Yeah, they still take cash.
Okay, so that once a year wellness visit, which is pretty much useless, you've said.
Yeah, but at least you're maintaining contact with them, and they kind of like that.
Yeah,
at least once a year.
Once a year to
know?
basically once a year to have someone that you can call that can refer you to an oncologist, that can refer you to get an MRI, that can
Right.
refer you. So
Yeah,
that's
because that's required. It has to go through your PCP to do.
so folks, that's pretty cheap to do.
Unless you don't have insurance, and it doesn't matter,
Well, I'm saying even without insurance, you still may want to get that referral and still use cash for them.
Right.
So it's still advantageous to keep that PCP just from the gatekeeper standpoint. Okay.
Yeah.
Let's if you look at insurance, we'll go ahead and digress into that.
Okay, so this is, I know you hear in the term insurance, you're just like, oh. But we're about to offer you some really good advice that could possibly save you thousands of dollars.
Right.
Okay?
Well, I don't want to get. Insurance has been a weird phenomenon. It started basically in the early 1900s. Really, it took off in the 1940s because there was a lot of inflation in the United States. So there was wage caps on what you could pay people. You could not keep on. So recruiting talent was difficult. So in order to recruit better employees, they started offering health insurance.
It's a benefit.
As a benefit. So it was
Right.
non-taxable. It got around the whole wage cap. And so everyone started liking it. The doctors liked it because it was convenient for billing.
Right.
It was a good system. By the time
They baited them, didn't they?
they did. By 1964, it was the standard. Most people had insurance through their company, and that's when things started to change. Insurance started dictating what was going to be paid, what was going to be allowed to be paid, how you practiced. They started changing a lot of what you did as a doctor.
Oh yeah, I remember when I was a dietitian, and I was working with a patient. I think they were about to be discharged, and their daughter was there, and she happened to be a physician, and we were talking, and I was like, yeah, I'm really thinking about going to medical school. And she looked at me and she said, don't do it. She said, and she just started going off on the HMOs and the plans, and she's like, it has literally, the insurance has destroyed medicine. And
Because of paperwork.
just because of all the hoops and things, and they weren't allowed to practice medicine anymore. It was very structured. There, you couldn't do this, you can't do that. They were being, what they wanted to do for their patient was being dictated by the insurance companies. And so she was just infuriated, and she just, she could not get her point made well enough. It's just, don't do it.
So insurance lulled.
But I did it.
Insurance lulled you guys in with the, hey, we'll take care of your billing. It's gonna be great. We'll level load risk. But then
Your life's going to be wonderful.
But then they changed it, and now
they took over.
They basically took over medicine.
Yeah.
So now you have to talk to someone who has a non-medical degree to tell you if you're allowed to get an MRI for your patient, or if you're allowed to do this for your
Well,
patient.
usually it's, those are pre-authorizations, and these are, oh, good Lord. When just hearing that word, you could be on the phone back and forth for, hours just to get an MRI approved for your patient. And the person on the other line is not even a physician, and trying, it's a game.
Well, it is
It's
a game.
a very cruel game.
It is a game because they used their authority to basically inundate you with paperwork, put up hoops to prevent.
Yes.
And also they made you see more patients per hour, because as they ratcheted down reimbursements, you had to see more patients.
Right.
And so that's where we got that 10 to 15 minute per visit. It's like, that's how we got here. It's the insurance in the way they reimburse. But the other thing they did is they play a shell game with pricing. And I love using the vitamin D lab as an example. We had
that was a patient. There was a lot of labs I wanted to order for her. And we had negotiated cash fee prices for our labs, because we have a lot of patients that either don't have insurance, or they have a catastrophic health care plan or a health sharing plan, and we're about to talk about that. It's where you can save some money. But she wanted to use her insurance for her labs, and her lab copay was a $20.80, right? So I was like, man, you could order these, and it's probably going to be cheaper on you than if you use your insurance. And she's like, no, I want to use it. I just want to use it. And I was like, okay, because I told her, I was like, my vitamin D level, it's our price is $35, and she just didn't. She wanted to use her insurance, so
she wanted to meet her deductible.
She wanted to try to meet her deductible. I don't know if that was the case or not. But anyway, she got the bill, and the lab company had charged her insurance company $1,000 for that vitamin D, which meant she had to pay $200, and the cash price was $35. And she was mad at me, and I was like, hey, I warned you.
So the purpose of that little anecdotal story is to say, insurance is not what you think it is. You think it's a comfort blanket that's going to protect you from things, but they've artificially inflated the prices to make you think that you need it.
You have to have it.
Right. And there are alternatives. The main thing
Much more so than ever before.
Right. The main thing I want you to walk away from this is that I want you to analyze your health insurance and what you do as a family as you would any other financial instrument. What am I getting out of it? Where can I save? How do I prepare for the future?
What do I need?
What do you need?
And what is my level of risk I'm willing to assume?
And what is the alternative if it doesn't?
Right.
And so cash fees for labs is well established. That you can navigate.
They're pretty darn cheap.
They're pretty darn cheap. Surgeries. Tell them about the.
Well, there's surgery centers now. They're the one that I'm most familiar with is located in Oklahoma. They offer a lot of different surgeries for cash fee pricing. They're pretty darn.
Posted online.
They're very affordable, and so that's something you should consider. Cash is still king. There are imaging studies that you can get paying cash that are an MRI for $550. CAT scans $250, ultrasounds $150, X-rays is as little. We had negotiated rates with an orthopedic clinic for $35 an X-ray. You know, that's not bad. You can even negotiate your hospital stay. Now, I had to do that when I got stung by a wasp, and it gave me an ileus. It was a 3-day stay. It was about around $6,000, almost $7,000, but I negotiated and got it down to around $3,000. Is what I ended up paying,
If you'll keep,
which was less than my deductible of $5,000 at the time.
right, because we'll talk about what you had, which is a little bit different.
Right.
But if you look at the plans, if you look at what you historically spend each year on your health, and you need to be objective, you need to map out what you spent over the last 5 years. If you look at the bronze plans, the Obamacare, which is bronze, silver, and gold, the prices are outrageous. The cheapest one you can get with an HSA for an individual, you're still going to have an out-of-pocket over $6,000. Plus, you have
Before it ever kicks in.
before it ever kicks in, and you're spending over $6,000.
Yeah, you might have a $25, $30 copay, but even then, I've seen these things are going up too. Even the copays are going up.
Right, but if anything happens, you're going to be on the hook for a lot of
Yeah.
money before it kicks in. So you have to factor that into your equation,
Mm-hmm.
and you have to factor in that imaging studies are not as expensive as you think. The labs are not as expensive. The surgeries are not expensive. So really, what are you preparing for us? I'm really protecting us for cancer or the ICU,
Right.
because
Some type of trauma or something like
all the
that.
basic stuff. So we belong to the Christian Health Share Ministries. There's 3 major ones. There's MediShare, Samaritan, and Christian Health Ministries.
Christian Health Ministries, yeah.
Yep, and
That's the one we use, CHM.
and they have all kinds. They have ones that are more comprehensive. They have ones that you just pay for what you need. You spend what, 40?
I spend $45 a month for $125,000 coverage per year with a $5,000 deductible per incident. Meaning, if I break my arm, that's an incident. If I'm admitted to the hospital for something, that's an incident.
Right, but so you
But I have not had any incidents since I was admitted to the hospital after that bee sting or wasp sting. Yeah, it was wasp.
so for double that, 250,000 would cover almost all, but just a handful of situations.
Right.
So I mean, you're talking about a significantly less amount of money.
And there's different plans too. There's different. You can get some that you'll pay $90 and get $250,000 a year worth of coverage.
Yeah, that's what yours is. It's an increments.
Yeah, it's just whatever you want.
So we looked at it. We're healthy. That's what we needed. If your family's not as healthy, what you need. This is why self-care is so important, because it makes you think about what this is you. The insurance is not going to save you. The doctor's not going to save you.
You are going to save you.
Yes.
Okay, you are.
Yes.
Stop putting all of the responsibility on everybody else. It comes down to you. Now I know there's things that happen. This is the world we live in. Accidents happen.
Well, they've not given us a lot of choices. So within the traditional Obamacare metallic plans, they only have 2 different plans that offer a health savings account. A health savings account is something that acts like a IRA, but it's for your health. At age 65, if you don't use it, you can use it for other things. It's wonderful. Well, if you look at the bronze plan, if I have to spend $7,000 a year for my premiums and I have a $6,800 deductible, and I have to contribute to my HSA, that's not really what an HSA is supposed to be. They don't offer it. The insurance companies have
They
not.
They won't do it.
They have drugged their feet, even though the mandate was removed almost 2 years ago. Nothing new has come out, and President Trump has touted
They've
that
got us. They're holding us hostage.
well, I mean, yeah, President Trump has said that there is catastrophic plans, but that's not quite correct. The catastrophic plans right now are for 364 days. So I can go get it. It's cheap.
Right.
But if I get cancer this year and I try to renew it next year, they'll exclude cancer.
Right.
So that's not what a catastrophic plan is really supposed to be. It's supposed to be, I just want to cover catastrophic events,
But they do.
but year after year.
They are. Pre-existing issues are covered in these plans.
No. In the metallic,
Not the catastrophic plans.
right, in the metallic plans. Right. So what we need is a catastrophic plan that does not have exclusions once you get it. Once you buy in, you should be covered.
Right.
It doesn't exist.
And you can't. And I wish we could have a catastrophic plan plus an HSA.
Correct.
That
Is what we need.
is what we need.
And
That is what the majority of you need, who focus on your health and take and your health is a priority. That is usually sufficient for most of you.
But the insurance lobby won't allow that because they don't want transparency. They artificially inflate prices. They make the plans very complicated. Everything's complicated when it really should be a la carte. I want to be covered for this, this, and this. This is my age. And they need, put in that risk factor. Do I smoke or drink or what I do?
Right.
They don't allow that. And it really sucks because that's where we are today, that all you have are these expensive plans.
That you don't need. I don't need maternity coverage. Don't need it.
And people are just not objectively looking at it. So analyze your
I don't need mental health services.
well, okay.
You might disagree, but I think I don't.
But I don't think anyone, and I think the reason people don't look at their health insurance like a investment is that a lot of them are getting it from work and quote, it's free. But to you guys who are employers, you should be looking at what can I offer my employees, because as an employer, you can negotiate things that are a little bit more nimble than an individual. And I think a lot of your employees would be very happy to have a catastrophic with an HSA, especially if you match their HSA.
Right.
And you would still be cheaper than you're spending. They'd be happier because they're making us cover everything, and it's just not cost effective.
No, everybody is different. That means you have different needs, but
Right.
we're all treated the same
So
with your insurance. And then once you get into the healthcare system, we're all the same.
And if they'd allow us to have an HSA with the Christian, the health sharing plans, that'd be great, but that's excluded. So really they're telling us what we're allowed to have, and they're not willing to fix really
But the change is going to have to come from you.
right, pushing your congressman.
The healthcare professionals like myself have been pushing for this. I have talked to many representatives, state representatives about this, about what we need. I think it just goes in one ear and out the other.
Well, the
you know,
entire
'cause
the entire
I'm not
discussion out there is
Contributing to their campaign.
the entire discussion out there is on access to health care. The Bernie Bros, we need universal health care. But what are you getting access to?
Access to crap.
Right.
So basically, where everybody's fussing over access. We all need health care. First of all, it ain't health care, it's sick care, and all you're going to have access to is people who want to prescribe pills and procedures for your symptoms.
So the vast majority of the allopathic model, I want no part of. I want the ICU, I want the ER, I want oncologist if I get cancer. The really bad stuff, that's what I want. Everything else, I don't want coverage for, but they won't let me exclude it. They
Right.
want, you got to get it. You need pregnancy and mental health and everything else, and unless you demand it, it's not going to happen.
Right.
And I get so frustrated with this whole fight over universal health care as a right. It's like we're fighting over a bone with no meat on it. It makes no sense. We're spending all of our efforts. It sucks all the oxygen out of the room. It has to be free. I don't want to give. It's like, you're missing the point, folks. You're arguing over something you don't want. Let's try to create
That's a terrible product.
Right. And that's what self-care is about, is removing that from them. It's like, okay, I don't need you for that. I'm going to take care of this.
Right.
I'm going to leave this
One
part-
can only dream, Paul. One can only dream.
Well-
that's why self-care is so important. So we can get you off this sick care system where
Right.
you're not dependent upon them. And then maybe hopefully you can get by with a catastrophic plan like Paul and I have.
Yeah, and it may not.
Seriously, $45 a month.
Mine's 75 because I'm over 55.
Yeah,
now.
you're old. So
I'm old.
you're-
Mine went up. But it's allowed us over the years to save for.
Yeah, we put money back to cover things that might happen to us.
It'd be great if I could be putting that into an HSA, but they won't allow that.
Right.
So this
It'll
is
be
what you
tax
need
deductible.
to push your representatives for. To stay in the system, you need a PCP. But beyond that, you need to be doing it all yourself.
Yeah, there's so much that you can do. It seems like they've convinced people that we have to have health insurance. We have to be going to see our doctor all the time. We have to be taking this pill to be and I'm just over it.
Well, 'cause
it's such a scam.
The doctor cannot make you healthy. You're going to have to do that.
You are going to have to make yourself healthy.
They're there once you've broken something, and no one's offering the way of fixing it before it breaks, and that's silly.
Yeah.
I know this was a little bit boring, but I don't
But
think.
we got some good stuff headed your way.
But it's
We
important.
needed to get this out of the way.
Yeah, it's important. You need to look at what you're using for your health. I mean, this is as simple as where's your nearest urgent care center. I think a lot of people come to us and they say, "You have a primary care provider?" No, I have an urgent care center. It's like,
Yeah,
okay,
they
that's
just
not
keep
quite-
going to the urgent care center all the time. And, I guess if you go occasionally and you go for legitimate, if you sprain your ankle or you break your arm or something, those urgent care centers are great.
How many times do you need to go to the doctor and they send you home with an antibiotic that's saying don't fill it because it's not bacterial and you need more rest and fluids? It's like it's the same. It's like how many times you have to go before you realize when you have a cold or flu, that's
I know, but some people are there's some hypochondria going on out there. We see the same people in the ER. The same 10% of people come to the ER all the time. They just, for whatever reasons, they can. Okay, and they love coming to the ER. And you see the same thing happen to the urgent care center. Everybody has to go for any little sniffle or sore throat or, any little rise in temperature. They're headed off to the urgent care center or the ER.
you can tell that it's not that needed because during the lockdown, those places have had no business.
I know they are like ghost towns in some of them.
So it's
And I still maintain contact with a lot of my friends who are ER doctors, and they're just like, yeah, we're kind of slow these days, which is, quite frankly, I never thought I'd ever hear an ER doctor say that. So I'm just kind of wondering which is not, I just wonder how many people are holding back from going to the ER when they really probably should be. I worry about that.
unintended consequences.
Yeah,
All right.
Anyway, okay, so yes, this was boring. We know that, but we're trying to save you money and we're trying to offer you some information that perhaps you didn't know about. I think that was the refrigerator that just kicked on.
Yeah, just picking up on the mic.
Yeah, anyway, so check out those plans that we said. If you're one that is very health minded and you don't have any health problems and you intend to focus on your health, look into the Christian Health Care Ministries, MediShare, or Samaritan Health. They have different plans and they can save you a lot of money.
And those are only 3 that we've vetted. There are other ones out there. One of them is in litigation, so I would not go.
Yeah, but these are very trusted. A lot of my patients use these.
Well, they were actually Obamacare compliant,
Yeah.
so that they were vetted by the government. Even.
And just remember, okay, you can use these plans. Cash is still king. You can go online right now and find ways to order labs and pay cash for them. You can get imaging studies for cash. They're very, very cheap. You can negotiate hospital stays for cash. I don't know a doctor one that still does not take cash.
Right.
So just because you don't have an insurance plan doesn't mean you can't go see a specialist. You can even schedule your own self. That's the beauty of not having insurance too. Is like you don't have to go through a gatekeeper as well.
Okay, so I can
You can call a I want to make an appointment with the cardiologist.
be say I don't have insurance, but I want to pay cash. Like, well,
And they're like, okay, yeah, we got an appointment today. Just so happen to have an opening. Can you be here in 2 hours?
all right. So there's just a lot of alternatives that people don't realize they
Right.
have, and we need to start complaining more because the system is broken. But this is what we're working in with now.
And seek out the direct primary care model of
If-
physicians if you have one. Just type it in, direct primary care physicians in my area.
Because
I know
it works really well with self-care.
Yeah.
it-
Dr. Bob Calhoun down in Monroe, Louisiana. He's a direct primary care family physician who is also working on his functional medicine training. I always like to put a plug in for him because Bob is a great guy.
Dr. Gray is in town. He's more concierge medicine,
Yeah, he's more concierge medicine. He's not a functional medicine doctor.
so he spends more time with you
You've got
than within the old model.
You've got Dr. Anna Erbst in Bentonville. You've got your Dr. Bob Calhoun down in Monroe, Louisiana. I don't really know of any more doctors in our state that I would recommend.
We're in the sticks, folks, but most people have more access than we do here in Arkansas.
Yeah, it is what it is.
All right. We will see you soon. Enjoy the extra of the Hellroys.
Yeah.
And we will bring you another exciting.
It will be much more exciting next time, I promise.
All right. Thanks.
Thanks.
I don't take nothing that a doctor don't prescribe. I don't do no drugs, man. I don't do no drugs, man. I